My husband leads worship and my father-in-law's the preacher, so Stetson always went nuts during praise and worship and during the service. Well, my husband, they'd played 2 songs and I noticed that Stetson wasn't moving like he usually did. So I started pushing on my stomach and I saw Jessica. She was the nurse I had the first time I came up here with contractions, and she gets me situated and she puts the fetal monitor on my stomach and I hear his heartbeat and I just start crying and she's comforting me. She's like, "It's okay, Crystal," rubbing my shoulder. The anesthesiologist comes in and talks to me and tells me what's happening and what's going to happen in the room, and so like, okay, this is happening. They lay me down on the table, they're getting me all ready. Dr. Hopkins starts the surgery, and they said, "Baby out." And when they said that, I didn't hear any crying. I didn't hear any staff saying anything. When they were wheeling Stetson by, I should not have looked, but I did. He matched the receiving blanket. He was that white. His diagnosis was hypoxic ischemic encephalopathy. Never heard that in my life. And so it's without blood, without oxygen to his brain. And so they kept him on a cooling blanket to prevent any other brain damage. He had pulmonary hypertension for some reason. They don't know what caused that, but his lungs were filled with fluid. That's one of the things he really struggled with to get off, was the nasal cannula because of the pulmonary hypertension. I've worked in the hospital for years, and so I've never been in the NICU, but I've seen patients hooked up to all kinds of machines. But I didn't expect what I saw when I wheeled into his room. He was hooked up to a lot, and so it was just heart-sinking. And so it was Dr. Clements and Nurse Pratt, respiratory and 2 nurses working on him. And so they wheeled me next to his little crib and let me touch his foot. Everybody who took care of Stetson did their very best. If I would have come when I had, if Jessica had to move as quickly as she had, if Dr. Hopkins wouldn't have made that call, if Dr. Clements hadn't have been there when she had, and all of the other staff, respiratory, x-ray, pharmacy, lab, if everybody wouldn't have done their very best on that day, at the time that they did it, Stetson wouldn't have made it. Every staff that we talked through those 32 days, they always said, if this wouldn't have happened at this time, he wouldn't have made it, or if lab wouldn't have got the blood out as quick as he did, he wouldn't have made it. They made me feel important, and they made me feel like what I was going through was okay, and they were very comforting because that was scary. So, forever grateful.